This week, I was doing some show prep and ran across a story. Those of you who keep up with libertarian type stuff know who John Stossel is, and he had a good piece on Reason.com about the question, and this is more still along the lines of government, but deviating a little bit into the healthcare industry, and his column was, should they be involved in Medicare or medicine at all? He made a real good point when he stated in the article, because Obamacare requires insurance companies to cover every child regardless of pre-existing conditions, WellPoint, Humana, and Cigna got out of the child-only business. Principal Financial stopped offering health insurance altogether. So now 1 million customers no longer have the choice to keep their insurance. This is to be expected when governments control health care. Since state funding makes medical services seem free, demand increases. Governments deal with that by rationing. Advocates of government health care hate the word rationing because it forces them to face an ugly truth. Once you accept the idea that taxpayers pay, individual choice dies. Someone else decides what treatment you get and when. And addressing the point that many people approve of government health care in Canada and Britain, he stated also down in the column that true surveys show that most Brits and Canadians like their free health care. But Dr. David Gratzer notes that most people surveyed aren't sick. Now, Gratzer is a Canadian who also liked Canada's government health care. That is, until he started treating patients. More than 1 million Canadians say they can't find a family doctor. Some towns even hold lotteries to determine who gets to see one. In Norwood, Ontario, the town clerk pulled 4 names out of a big box and then telephoned the lucky winners. Congratulations, you get to see the doctor this month. But repealing Obamacare is not enough. We need to get the government out of healthcare market altogether. And he states a little bit more down in the column, contrary to what some Republicans say, we didn't have a free medical market before Obama came to power. We had a system that limited competition through occupational licensing, FDA rules, and other government intrusions, while stimulating demand through tax-favored employee-based insurance, in quotes, Medicare and Medicaid. And he wrapped up the column with, if we want affordable and cutting-edge health care, there's only one approach that will work. That's open competition. That means eliminating both bureaucratic obstacles and corporate privileges. Only free markets can give us the innovation at the lowest possible cost. Of course, that also means consumers should spend their own money on health care, limiting insurance to catastrophic expenses. Unfortunately, Americans don't want to hear that because that's the truth. Again, that was a column by John Stossel at Reason.com. You can find it there if you go over to their website, interestingly enough, at Reason.com. Again, it was by John Stossel, came out June 14th, entitled, Why Should Government Be Involved in Medicine at All?